Oh,
Oh, you did?
you're just gonna go crazy,
Right
huh?
into it.
Bunion surgery can be very confusing to a lot of people because they feel, through talking with friends and other people that have had bunion surgery, that it could be a long, extended period of recovery. And that's not necessarily true. And there are more updated procedures that can have a patient walking within 2 weeks after surgery and have a corrected bunion. I would really recommend any patient that's thinking of bunion surgery to have it evaluated first. There's no pressure to do surgery with that first appointment. We're just going to go in there and take x-rays, evaluate the foot, and give options because we want to tailor the patient's care to that individual, to their age, to their activity level, and to their overall health. Most people think a bunion is just a growth, but it's actually an abnormal angulation of the bone. A lot of it is hereditary. So if mom or dad had bunions, or grandpa or grandma had bunions, you can blame them for it because it's probably the reason why you have it. A smaller factor is shoe gear, and sometimes even trauma can be a contributing factor. Over time they will get worse, and they can cause a considerable amount of pain. But if you don't have pain at all with it, a lot of times we can control that with good orthotics and good shoes. But if once you start having a little bit of pain with that bunion, it's good to have it addressed early on so you can prevent further deterioration of joints, and that can lead to other procedures that are more involved. You know, I've done bunion surgery on patients as young as 15 years old. People think that you have to wait until you're older to have bunion surgery, and that's not true. In fact, I think the best results are in people when they're younger and they have healthy bone. We can do a lot better correction. You're going to heal quicker, and you're going to have a better outcome. If you've tried different shoes, if you've tried arch supports, and it's still painful and it's not helping you at all, that's generally when you need to do bunion surgery. In fact, most insurance companies will approve for a bunion surgery as long as we can prove that we've done conservative measures. We can usually have you walking within 2 weeks, okay? So that's the really great thing that I've seen happen in the last few years of bunion surgery is the advanced fixation techniques that make it stable to walk on almost immediately. But again, we want to have that incision heal nicely, and that's generally 10 to 14 days until we take stitches out. If you do have pain in your great toe joint, come in and be evaluated at Orthopedic Associates.